We had case study number 3, who was a patient that was being seen for a persistent productive cough with purulent sputum. He had a 30-year history of smoking and medical history of extensive facial reconstruction for squamous cell carcinoma of the head and neck.
The disease process for the Streptococcus pneumonia was ongoing, and it presented as shortness of breath and a persistent and productive cough. There's a severity index, which is used to classify pneumonia, and any patient who's classified above a 1 or 2 on the index is considered high risk and needs to be hospitalized. Some things that contributed to this pneumonia were respiratory compromise, hypotension, and chronic heart, lung, or renal disease. And the reason the decision was made to hospitalize this patient was due to infiltration of the left lower lobe in the x-ray and the severity of the pneumonia as shown through the pneumonia severity index.
The organism for our case study came out to be Streptococcus pneumoniae, and we know that by the blood agar that is shown, it shows that it is alpha hemolytic and that the 2 white dots is a zone of inhibition that is greater than 14 millimeters, and that is 2 opticon discs, and that is used to differentiate between which strep bacteria. And we can see that since the zone of inhibition is greater than 14 millimeters, that is a strong tell that it is strep pneumoniae.
Patient populations at risk include infants and young children, especially children under 2, the elderly, people with medical conditions, immunocompromised, chronic heart and lung patients, which would be COPD or asthma, and liver and kidney disease. The 2 virulence factors important in disease pathogens, these include the first one would be the capsule. It's made up of polysaccharides and surrounds the cell wall. It also helps in escaping phagocytosis by preventing the access of granulocytes. And it also has polysaccharides help in identification and serotyping of bacteria. The second virulence factor would be the ability of adherence to the respiratory epithelium and invasion. It allows the bacteria to start the infection in the first place. It attaches, colonizes, and then invades. And invasion, once it's attached, can cross the epithelial barriers.
Some of the strategies available to prevent Streptococcus pneumonia include the pneumococcal vaccine, proper hand hygiene that would prevent droplet and contact spread of the illness, as well as covering coughs and sneezes, which will prevent the droplet spread of the sickness. Not smoking, because smoking causes respiratory dysfunction, which will make you more susceptible to contracting the sickness. And managing chronic diseases such as COPD and diabetes, because these can suppress your immune system. This is important because it's going to reduce your morbidity and mortality. It's going to prevent things such as sepsis and meningitis. It will protect other high-risk populations, including the elderly and infants. And it will limit antibiotic resistance because we're not taking unnecessary antibiotics. Patients that have repeated infections of Streptococcus pneumonia often are immunodeficient, which means that their body is not able to recognize the antigen within their body, or they are not able to create the proper antibodies to kill off the bacteria that they have within their body, which allows them not only to get easily infected, but also be easily reinfected if it's living dormant within them. Another thing that would cause repeated infections within patients is chronic conditions such as COPD and diabetes. This is because it causes a weakening of the immune system and damages normal defenses, like the ability to be able to cough up things that get within your lungs, so then the bacteria will stay stagnant within your lungs.